Dr. Zhao, the characteristics and prognosis of colorectal cancer in patients under 35 years of age.
Good afternoon, ladies and gentlemen. My colleague Li Zhao, Dr. Li-Ying Zhao, she could not come here, so I have to replace her to present this study. This study is colorectal and prognosis of colorectal cancer in patients under 35 years of age. I have nothing to disclose. Background: clinical characteristic and prognosis of young patients with colorectal cancer is unclear. The definition of a young patient in the literature shows a great difference. So the purpose of this study is to evaluate the clinical characteristic and the prognosis of young patients with colorectal cancer. This is a retrospective study. Totally 941 patients was included and divided into 4 groups. Group 1 is from 18 to 35 years old, and group 2 is from 36 to 45 years old, and group 3 is 46 to 55 years old, and group D is 56 to 65 years old. And this is the inclusion criteria and exclusion criteria. And results show the group 1, more rectal cancer and more mucinate ring cell in pathology and cytology, and there are significant differences. And the tumor differentiation and tumor stage is also significant. And most in group 1 has more stage 3 cases. Median follow-up is almost 18 months. 5-year disease-free survival is significantly in group 1 is worse than other group. And 5 years cancer-specific survival is the same. So this table shows the disease-free survival and cancer-specific survival are worse than other group. And more stage 3 and in this study. And the multivariable analysis with Cox regression show the age is the red fast. So this is the supplemental data why we choose 35, because in this table here we did not find different if we jot 40 years as cutoff. So in conclusion, the prognosis of the colorectal patient ages 80 to 35 years old were worse than the old patient, especially in stage 3 disease. Thank you for your attention.
Thank you. Well done. Here, so most of the significance was found in the stage 3 patients.
Yeah.
So here it's standard practice that stage 3 will go on to get adjuvant chemotherapy. What is standard practice in China, and do you know the breakdown of who amongst the stage 3 patients got chemotherapy and how that affected their prognosis?
Yeah. Okay. It's close. We usually the patient choose the 4-course chemotherapy, and especially the young patient, they receive more cycle, like this one. And old patients, sometimes they give up. Yeah. Do
you know if, in general, most patients in the study or all patients in the study with stage 3 disease got chemotherapy?
Yes.
Was that looked at? Okay.
Yes.
Thank you. Question from the floor?
Yes, thanks. George Molina from Boston, surgical resident. I'm curious to know if there's any data or information on whether younger patients were less likely to go to the hospital initially because of symptoms, just because they're young and healthy, and maybe thought that, abdominal pain or whatnot was not that significant. So that's a factor.
So the question, to make it simple, is do we know anything about duration of symptoms before presentation for young versus old? Do you have any sense? Do younger patients
It's the same, I think.
same duration of
Yeah, yeah.
symptoms?
Okay.
Yeah, this is retrospective study. We choose the same criteria.
And in that younger population, since in general that's not in the screening pool for colorectal malignancies, what are the screening practices for colonoscopy recommendations in China?
In China, just the OB test. Yeah, it's very
Fecal
simple.
occult blood testing.
Yeah,
Called
yeah.
blood test. Okay.
Is that standard now amongst
It's standard,
China
yeah, yeah.
available? That's
Yeah,
your screening
it's,
method?
Yeah, screening is very good.
At what age do you generally start that? The age?
What age do you start fecal occult?
In
50?
China, no, it's 14, more than 40.
40.
Yeah,
40,
40,
okay.
yeah.
One last question. Do the pathologists perform MSI testing of cancer looking for microsatellite instability?
The pathology,
In the pathology?
yeah.
And do you know, do the younger patients have more MSI unstable?
I have to, because this is my colleague's study, I have to
That's
check
okay.
the data.
No, that's good. That's a good question. It's just
Yeah.
a question. All right, so young patients in China
Yeah.
with colorectal cancer, worse prognosis.
Yeah,
That's the message.
yeah.
All right.
Yes,
Thank you very much.
thank you.